I'm Fredi Kronenberg. I'm a physiologist with expertise in women's health and alternative medicine, and also very involved in healthy food and bringing healthy food to hospitals, bringing healthy food information to a greater group of healthcare professionals. One of the things that is going on lately is that there's a tremendous surge of interest in improving food in hospitals. And this is terrific, and people are making slow but increasingly steady progress. However, a missing piece of the equation is that doctors still don't get nutrition information in medical school, nor do nurses. So here you have the health profession who are telling people to eat better, to cook better, to take care of themselves in terms of what they eat, and they don't do that for themselves, and they don't know much about the growing body of nutrition information showing how actually what you eat does affect your health and your health outcomes. And even more so today, we're learning that what you eat affects gene expression. So just because you have a particular genetic propensity doesn't mean that you will get that particular condition, because you can in fact impact that with the food you eat. So it is really critical that doctors learn more about food. We know now that there are particular foods, for example, that help cancer patients and many illnesses which are inflammatory driven, which are driven by all sorts of inflammation in the body. And we know, and there's been a long history of information about cultures who use different herbs and spices to reduce inflammation. And there are people now touting anti-inflammatory diets. There are certain foods that promote inflammation and certain foods that reduce inflammation. And that information is now being taught much more widely, being researched, so that there is an information evidence base for these things that people have been saying for years. So for example, turmeric, which has been used, curcumin, in Indian cooking for years, is one of the most anti-inflammatory herbs and spices that we know. And it's very valuable for cancer patients and other patients who have inflammatory-driven conditions. So these are the kinds of things that we can easily teach doctors. And one of the things that I've been doing over the last 10 years in collaboration with Dr. Andrew Weil is that we've developed a conference for doctors, nurses, other healthcare providers on nutrition and health. What's the latest research? How do you incorporate that into your clinical practice? What can you take to your practice tomorrow and tell your patients? What can they do first, as a first line, before you turn to the drugs? Drugs are a great resource to have, but you don't always need them as your first line of defense. You can always bring on the big guns later. Why not use nutrition to try to control diabetes first? Why don't you use nutrition to try to correct cardiovascular disease first before you go to drugs? And there's a lot of information. Now, people say there's no information about food, no research, but there's a tremendous research base, and that's all happened, in the last 10 or 15 years, where there's been government funding, there's been private funding in this area of nutrition and health. So it's very exciting, and more people are appreciating that, but yet there's still not a lot of programs available where doctors can get this information. There are few programs being offered, postgraduate courses for doctors already out in practice, but there's still very little available in medical school. So there's a group of people working on the medical school end of things, and there's a group of us working on the postgraduate end, and hopefully in shorter order, more and more physicians will be knowledgeable to direct their patients to the right people and to the right direction